Hey everyone, today we have a battle royale, the battle of the titans if you will. So we're going to do a comparison between Medicare Advantage plans versus Medicare Supplement plans here with 2023 numbers. Who's going to come out on top? Before we get too far into this, if you live in a world where there is a one-size-fits-all answer for every human being, no matter what their personal circumstances and priorities and health needs and financial situation, this is the wrong video for you. Medicare is a big decision for a lot of people with a lot of variables, so we're going to present the facts around Advantage plans and Supplement plans in the most unbiased but unexaggerated way that we can. We get comments all the time that say, hey, you only compared this plan to that plan in a certain area. As much as we love all of you, for us to compare every plan in every state would turn into a 14-day long video that we just can't do. So we have to make certain assumptions, and I hope you will forgive me for doing that. If you would like to know specifics about your area, feel free to reach out. Now I'm going to outline my assumptions right now. If you don't care to know how I chose to compare what I chose to compare, there are chapters below and you can skip this part and go to the section that you would like. What I use in my assumptions are the most common plans that are available across the country and the most common choices that we see people make when they have all of the choices in front of them. So for this video, we're going to compare a $0 premium Medicare Advantage plan to a Medicare Supplement Plan G. Why not a Plan F or a high deductible Plan G or a Plan N? The short answer is time, availability, and the popularity of the plan. The long answer is Plan F is not available to everyone anymore, and if you became Medicare eligible on January 1st, 2020 or later, you cannot get one, so that eliminates millions of Americans. Also, at this point, in most cases, Plan F is more expensive than the added benefit that it offers compared to Plan G. So if you are on a Plan F and you'd like to save a little bit of money every year, you can likely do so by moving to a Plan G, but this video is not about that. Why not a high deductible Plan G? Well, because they aren't available in all states and only a few insurance companies offer them. Regular Plan G is much more readily available to everyone watching rather than a smaller group. Regular Plan G is the most popular supplement plan right now in the country, and for very good reasons. Well, why not a Plan N? Well, this answer is very similar to the previous one, and it's mostly around popularity. Now, why a $0 Medicare Advantage plan and not one that costs more money? 69% of all Medicare beneficiaries who have an Advantage plan are on a $0 premium plan, and these are the most prevalent in our area as well. By the way, I'm physically located in the Rocky Mountains, so Mountain West region of the United States, if you haven't picked up on my accent yet. In an effort to compare as close to fair as we can, we include the assumption that standalone Medicare Part D prescription drug plans, dental, and vision products would be added to a supplement plan in this whole equation. You do not have to get any of these, although most choose to at least get a Part D prescription drug plan. Finally, from a dollars perspective, things are highly dependent on where you live. Take Plan G as an example. There are parts of the country where a Plan G for a 65-year-old is $100 per month. There are other parts of the country where they are over $300 per month for that same 65-year-old. Looking at you, New York, we're going to go with what we have available in our surrounding states, so know that the figures could be better or worse for you depending on where you live. All right, we'll point out any other assumptions as they come up, but we're ready to dive into which plan is better. We have 6 major categories that we will use to weigh the two, and then I'll let you decide which is best for you. We've already touched on the first category a little bit, and that is premiums. Premiums are the fixed monthly dollar amounts that you need to pay to even have the plans. You pay the premiums whether you use the healthcare system or not. The clear winner here is Advantage plans. As we mentioned earlier, most Advantage plans are $0 premiums. If they aren't $0 premiums in your area, they are likely less than $49 per month. 88% of all Advantage plan beneficiaries in America pay less than $49 per month. Supplement plans have higher premiums that are usually age-based. What this means is that every year, your supplement plan premium will increase in cost as you move into a new age bracket. For example, a 68-year-old will pay a little bit more than a 67-year-old. In addition to the annual age bump, the insurance companies typically do a rate increase across the board to account for things like inflation and rising healthcare costs. So it is not uncommon to see 2 premium increases each year with supplement plans. Some years you may see little to no increase, followed by another year with a bigger increase, but the bottom line is your supplement plan premiums do increase over time. There are supplement plans that are community rated that do not follow this same pattern, meaning that you do not get an increase based on your age. You still will get those annual increases that are based on the inflation and the rising healthcare costs, but it's not based on your age. However, those are more of an exception than a rule. Now in our area for a Plan G, the average premium for a 65-year-old is around $150 per person per month, or about $1,800 per year. Above 65, it goes up a little bit. The other bummer when it comes to supplement plan premiums is that let's say that you have a health savings account or an HSA that you've accumulated over your entire life. You cannot use your HSA dollars to pay for supplement plan premiums without a penalty. So Advantage Plan, $0 per year in premium, where an HSA can be used if you do have premiums, versus $1,800 per year for a Plan G where you cannot use HSA dollars to pay premiums. There really isn't a debate here when it comes to premium costs. This goes to Advantage Plans and it really isn't close. But don't stop watching here. There are reasons for this, which you will see. All right, let's talk about the next category, which is other coverage options. Advantage Plans often come with prescription drug coverage, various levels of dental and vision coverage, and hearing aid coverage included in that $0 or low premium plan. Supplement plans do not come with any of these things. You can get these separately, but you will have to pay for them on top of the already higher supplement plan premiums. To give you an example, the average Part D premium in 2023 is $31.50 per person per month. A typical dental plan premium is about $30 per month. A vision plan is about $12 per month. Add in hearing aids and you're looking at a much higher monthly premium with supplement plans. Each of these plan premiums typically increase a bit each year as well. Now we have another video on our channel that goes over the entire financial conversation up here. The results of that show a premium difference of about $2,700 per year more with a supplement plan versus an Advantage plan. Advantage plan takes this one as well. The next category would be other perks that come with your insurance coverage. Things like gym memberships, transportation to and from doctor visits, meals after visiting the hospital, and a quarterly allowance for over-the-counter supplies. Many Advantage plans come with all of this included, again in that $0 premium. Supplement plans don't. Now, there are some supplement plans that do have a gym membership, but they just don't come with all of the same bells and whistles. Advantage plans take this category as well, and so far, Advantage plans seem to be running away with this one. But hang in there, my supplement plan friends. Things are about to change. Let's talk about cost sharing. There are dollars that you need to pay out of your pocket when you actually use the healthcare system. Think visit the hospital, get tests, visit the doctor, and surgeries as examples. With those $0 premium Advantage plans, most have copays and coinsurance for most healthcare services. So you go and you see a specialist, there's a copay. You get an MRI, there's a copay. You get an x-ray, there's a copay. You have surgery, copay or coinsurance. You pay those copays and coinsurance amounts until you reach your plan's out-of-pocket maximum. These vary dramatically across the country. In our area, the average out-of-pocket maximum is $5,500. In other areas of the country, they are as low as $1,500 or as high as $8,300. That is for in-network. If you go out of network, that's a different story, and we're going to talk about networks in the next section. With a supplement plan, specifically Plan G, all you have to pay is the Part B deductible, which is $226 here in 2023. After that, your Plan G will take care of 100% of the costs for all Medicare-approved Part A and Part B procedures and expenses. This is unbelievable coverage. In that same cost comparison video, it shows that in a bad year where you have to use the healthcare system a lot, whether because of surgeries, chronic conditions, cancer, or other high-cost issues, you could save around $2,500 a year in a bad year if you have a supplement plan rather than an Advantage plan. And if you have multiple bad years, year over year, supplement plans are a no-brainer. So when it comes to your cost sharing, if you have high healthcare costs that will be higher than the difference in premium amount, supplement plans win this one. Now, the next two categories have financial components tied to them, but they are much more focused on peace of mind and the freedom for you to make your healthcare decisions. The next category is the network. Now, Advantage plans come in two network varieties, an HMO, which stands for Health Maintenance Organization, and a PPO, which is a Preferred Provider Organization. In general, with an HMO, you need to visit doctors and facilities that are in the insurance company's network for you to get coverage. If you don't and you go out of network, you are responsible for 100% of the costs. In general, with a PPO, you have in-network doctors and facilities that you're going to want to visit. You can also visit out-of-network doctors, but you are going to pay more for out-of-network visits. Your out-of-pocket maximum goes up for out-of-network visits as well. So instead of that $5,500 out-of-pocket maximum that we mentioned earlier, in our area, we see between $8,300 and almost $13,000 as the out-of-network maximums. With Advantage plans, if you have an emergency outside of your coverage area and you visit an out-of-network facility or provider, this is covered as in-network. It must truly be an emergency. So if you have the flu and you go to the ER out of network, that won't be counted as a true emergency. Now, I know that the knee-jerk reaction is going to be the insurance company won't agree to anything being an emergency so that they can avoid paying. Now, there are carriers that will deny claims. However, you would be able to appeal those claims, and there are medical codes that will put an emergency room visit tied with the diagnosis to where it should be covered. So when it is an emergency and coded as such, you are covered as if you were in network. However, there can be maximums on this coverage as well, so just be careful. Another important part of the Advantage Network conversation that is important to understand is that if you are looking for an Advantage plan and you're working with an agent, you aren't just picking at random some plan willy-nilly and crossing your fingers that your doctors are covered. You can search for in-network providers before you get your Advantage plan. In fact, with all of our clients, we will get a list of their providers and preferred hospitals, and we will do a search for them to make sure that the doctors participate with Medicare if they're thinking a supplement plan, or we will search for Advantage plans that have their doctors in network. Fair warning, some providers are not a part of any Advantage plan networks, and you would need to find a new doctor. Again, you do have networks with Advantage plans, similar to networks that you have experienced on your employer plans. These are managed care plans managed by the insurance company. All right, supplement plans do not have a network. Now, the fans of supplement plans usually say, I can see any doctor I want and you can't on Advantage plans, followed by taunting in some form. That's not entirely true. We talked about this earlier, but with a supplement plan, any provider or facility that participates with Medicare will accept your supplement plan anywhere in the country. So this is not 100% of all providers and facilities across the country, but it is a whole lot more than what are available with an Advantage plan network. This gives people a lot of peace of mind because they don't really have to worry much about whether or not they can see a doctor or a specialist. However, you will still want to make sure that your facilities and providers participate with Medicare. The clear winner here is the supplement plan, and it's really not close. All right, the last category is the administration of the plan. Think of this as the ease of use and will your plan work for you when you need it to. With an Advantage plan, all benefits are administered by the insurance company. Remember, it is a managed care plan. The insurance company has a say over your healthcare decisions. Advantage plans agree to cover everything that original Medicare covers. However, they do not cover them in the same way. This means that with many Advantage plans, you would need a referral to see a specialist, as an example. You may have an MRI denied because the insurance company wants to see a different test run first. You may have pre-authorizations that you must do before getting the care that you or your provider think that you need. An insurance company is managing your care in hopes of saving money. They will say it is to help patients and providers make more wise healthcare decisions, and there is truth in that. We know a lot of people who work with and at insurance companies. I can promise you that they are not evil people. I can promise you that they genuinely want to help people. However, they are trying to manage healthcare spend to stay profitable. The federal government pays insurance companies who offer Advantage plans a certain amount per month to take on the risk. We don't have the actual amounts, and they vary based on where you are, the ratings of those plans, and the risk that they take on. But for this example, let's say it's $1,000 per person per month. The insurance company is incentivized to have as many people as possible cost less than $1,000 per month to remain profitable, as they pay for the people that cost much more than $1,000 per month. It's how insurance has always worked. Now, a lot of negative pressure is on Advantage plans because some have implemented policies that auto-deny care or deny care that should not be denied, as an example. This is wrong, and the federal government has a vested interest in fixing this problem. This is not all Advantage plan carriers, but it is not uncommon. So the bottom line with Advantage plan administration is that an insurance company has a say in your healthcare decisions. One of the glimmers of hope with Advantage plan administration is that it is all under one roof, meaning that it is with one ID card that you practically use everywhere. One login, one password for online portals. It's much easier in that sense. Supplement plans are a different story. The one downside to supplement plan administration is that you could have a bunch of different cards. Remember that you're getting your supplement plan, and then you're getting a standalone drug plan, a separate dental plan, a separate vision plan. Now you have your Medicare card, your supplement ID card, your prescription drug card, your dental card, your vision card, mixed in with your ID and your Costco card, and who knows what other cards you have in your wallet. And all of the different plans have separate usernames and passwords for those online portals. It's a lot to keep track of, but it might all be worth it because supplement plans pay secondary to Medicare. If Medicare covers it, the supplement plan covers it. No questions asked. Now again, the exaggeration often comes in here that with a supplement plan, you never have pre-authorizations, you're never gonna get anything denied. That's just not true. If Medicare does not cover something, your supplement plan won't cover it either. You can't just go and do whatever you want whenever you want. However, You do not have the same management of your care, and denials for Medicare covered procedures that you could see with an Advantage plan don't happen with the supplement plan. I can tell you that providers and facilities prefer working with original Medicare and a supplement plan for this reason. So the winner of the administration category is the supplement plan. And again, it really isn't close. So as you can see, we have a tie, 3-3, and this is intentional. It is inaccurate and entirely misleading for someone to say that everyone should get an Advantage plan or that everyone should get a supplement plan. So who do we typically see lean towards each of these? In general, an Advantage plan works really well for people who put more weight in lower monthly premiums and fixed costs, either because they cannot afford hundreds of dollars a month going the supplement plan route, or they just hate paying for something that they don't use. People who are okay using in-network providers like they have their whole life and understand how managed care works and are not worried about that typically do well with Advantage plans. People who have a higher risk tolerance and feel that they will have more good years where they are able to save money on premiums than they will have bad years where they will pay more in copays and coinsurance lean towards Advantage plans. Nationally, only about 3 to 5% of Medicare beneficiaries hit their Advantage plan out-of-pocket maximums, so the risk is there, but the risk is low. People who have the funds to handle bad years or multiple bad years, especially those with large HSA balances, enjoy the premium savings with Advantage plans. In short, people who weigh the first 3 categories higher than the last 3 categories favor Advantage plans. In general, Medicare supplement plans work well for people who are higher utilizers of the healthcare system. If you have a chronic illness, diabetes, need a lot of surgeries, and have a lot of hospital visits, a supplement plan is your best bet. People who value the freedom to go to more providers and not worry about denials and managed care like supplement plans. People who have lower risk tolerances, meaning they are uncomfortable with the risk of a bad year or bad years, and they would rather pay now and not have to worry later if something does go wrong, they prefer supplement plans. In short, people who weigh the last 3 categories higher than the first 3 categories favor supplement plans. Also, Advantage plans are not available everywhere, especially in the more rural parts of the country. So people who live in areas that do not have access to Advantage plans don't have a choice and would have to go the supplement plan route. Another distinction to make as we compare these two. So when you first go on Medicare, if it is at 65 years old and you choose an Advantage plan, you do have 1 year to decide if this is what you like. If within that year you want to switch, you can switch to a supplement plan and there are no questions asked. It's guaranteed issue. You don't have any medical underwriting or healthcare questions. If you go past that year, or if you go on Medicare after 65 for the first time and you choose an Advantage plan, and let's say you want to switch to a supplement plan, you are subject to medical underwriting. And what this means is that the insurance companies who offer a supplement plan can ask you health questions, they can ask your doctor's health questions, and if you are too high of a risk, that insurance company could deny you and not offer you a supplement plan, or they can offer it to you, but it will have much higher premiums. If you choose a supplement plan when you first become eligible for Medicare or when you first go on Medicare, if it's after 65 because you were working, then you are guaranteed issue, meaning they aren't going to ask you questions. It doesn't matter what health problems you have, you will get a supplement plan. So this gets a little bit tricky because, again, the main reason why most people are going to switch from an Advantage plan to a supplement plan is because something went wrong and high costs are coming. And if this is the case and you want to make that change, well, the insurance company is going to know that and they may not write you. Now, you may feel very strongly one way or another. It's important to understand that what you value is not the same as everybody else. We have spouses that even disagree, which is another important point. Spouses do not have to get the same thing. Medicare is an individual decision. One spouse can get an Advantage plan, the other spouse can get a supplement plan. My parents, as an example, chose differently. One has an Advantage plan, one has a supplement plan. Neither is inherently good or evil, despite what you might read. Here's the last thing to talk about because, again, you get people who are very passionate about this. I don't have a preference which of these 2 options that you choose. I told you that my parents chose 2 different options. I've tried to stay as unbiased as possible by presenting factual information about both, not exaggerations or false claims. But there is something that you need to know about agent commissions. Agents who help you with Medicare make more money in commissions from Advantage plans than they do with supplement plans. You do not pay more money for using an agent, whether you go with an Advantage plan or a supplement plan. Insurance companies pay agents through the plan, but that does not mean that you are going to pay more for using an agent. If you go to XYZ insurance company all by yourself without an agent, you will have the same plan at the same cost as if you had used an agent to help you. Commissions come from both Advantage plans and supplement plans, as well as prescription drug plans, dental, and vision plans. So in full transparency, agents do make more money with Advantage plans. In fact, supplements with Part D and dental and vision commissions are about 62% of what the Advantage plan commissions are in the first year for us here in our area. However, if an agent is pushing people on Advantage plans where that is a poor fit, that agent will not be in business long. In the long run, we are much more stable doing the right thing and not chasing higher commissions. We are not here for a quick dollar. We have people on our team who have been helping serve Medicare beneficiaries for 3 decades. We're Medicare nerds, and we want to be able to help people not just now, but in another 30 years. And people talk. 99% of our clients come from client referrals because the person is happy with the decision that they made and the help that we were able to offer. We know hundreds of agents across the country who feel the same way. Just so you know, on the whole, we have more clients with supplement plans than Advantage plans, but it is close. There are millions of people across the country who love their supplement plan. There are millions of people across the country who love their Advantage plan. Every person is different, and you should not make your Medicare decisions based on a YouTube video. You should not make your Medicare decisions based on your friend or a family member. People in my own family have said, well, wait a minute, my sister has this plan with this insurance company, and I want what she has. Then as we talk about their lives, we realize that you and your sister do not have the same financial picture, you don't have the same health profile, you don't have the same risk tolerance at all, you don't have the same medications. You're not the same person, and that's okay. As I mentioned, even spouses can and do make different choices when it comes to their Medicare plan, so please, work with an agent. It doesn't cost you anything ever. If you have that person in your life, use them. If you don't, we're happy to help, and if we can't because we aren't in your area or we aren't licensed in your state, we can direct you to agents that we trust to do the right thing for you. Okay, now this is the last thing that I'll discuss in this video, and this is my last words of warning. The vast majority of Medicare marketing out there is pushing to Medicare Advantage plans. Specifically, it is pushing you to call a national call center that is funded by venture capital, trying to make high, quick dollars to please shareholders. These call centers represent a couple insurance companies and Advantage plans. We always recommend working with a local agent, not a national call center. The service that you would and should get when it comes to Medicare will not come from a call center, and this has led to huge problems nationally with all of the complaints to CMS and misunderstanding what Advantage plans really are. Please be careful with the commercials. I'm sure that you will see. All right, that's all I got for this one. If you found this helpful, please follow our channel for all things Medicare. If you are feeling super generous, throw in a like and a comment about the best thing that has happened to you today. Thank you for taking the time to invest in your Medicare arsenal of information. As always, I appreciate you and thank you for watching.